So the second question I have for you is, what do we do if a family member is sick and unsure if they have COVID-19?
The first thing that I would do is assess your family member. So if they're having trouble breathing, if it's an elderly family member, and you notice that they're not thinking as clearly as they were, they're not maybe walking as easily, even if you notice some blue discoloration around the lips, this can all be an indication in older people that they're not getting enough oxygen. And the most common manifestation of COVID-19 is in the respiratory tract. So people have shortness of breath and they're not getting enough oxygen. And if that's the case, then your family member needs to go to the ER to be assessed by a doctor there. If your family member is not in distress and they can safely stay at home, then you should keep them at home for at least 14 days. That family member and all family members that have been in contact should all stay with each other and not expose themselves out into the population where they can spread it to other people. You can always contact your doctor to see if you would be a good candidate for testing.
Yeah, I've actually had quite a few patients who had this situation, and for me, it's just one of those things where I keep telling them, whether you just stay home, quarantine yourself, conservatively treat your symptoms, and then instead of going out there and actually exposing yourself to other sick people. And so that's like my biggest key to let people, if you're doing well, just stay home, treat your symptoms, and get better.